Hi, my name is Deniz Gocken. I'm one of the board certified plastic surgeons here at Wave Plastic Surgery. And I'm talking with the founder of Wave Plastic Surgery, Dr. Peter Lee. Hi, Peter.
Hey, Dennis. How you doing?
It's funny to talk to you on camera, but we talk about a lot of this stuff just in general. What makes Wave special?
I think one of the things that I'm really proud of about Wave is, although we're plastic surgery, it's not just about surgery, right? I mean, the technology and just the demand of the patients in general now is focused also on technology and non-surgical procedures. So I think it's rare for a practice, at least here in the US, where we really do cover the entire spectrum of non-surgical to surgical and procedures in between. And I think the ability to actually be able to offer patients the variety and choices of what's available out there, and as we speak with patients and as we discuss and evaluate and analyze the patients, to truly be able to offer them a customized plan, right, that really fits in with not just their condition, right, but also their social economic sort of consideration as well.
Absolutely. I think that we've both been in practice for many, many years, more than 2 decades, which kind of dates us a little bit, but it's with experience hopefully comes some wisdom. I think that we've gone out of the way to try to meet the patient's needs. And I don't think you've only done it with the technology here at Wave, and we're going to come back to maybe address that a little bit with facelifts and the non-invasive ideas and technologies that we have available. But also, just could you mention a little bit about the infrastructure that you've built over the many, many years that you've been building Wave Plastic Surgery?
I mean, as far as the infrastructure is concerned, I mean, to run a practice, you really do need, and to run a practice that is designed for pretty much sort of the avant-garde of plastic surgery and aesthetic procedure, you really can't discount technology and the investment that it takes to actually be able to offer and keep up with a lot of technical advancement that's out there in the aesthetic world. The skill set and obviously the surgeon component to that is important. But there is no discounting that in order to be able to offer patients full spectrum of options, you really do have to be able to invest in the entire technology that's out there.
So let's talk a little bit about that investment in technology, because you've definitely made it, there's no question. And at almost any plastic surgeon's office, he'll have access to a certified surgery center and could do, say, a facelift. I think one of the differences here at Wave is both at the edge of beginning facial rejuvenation type procedures to the endoscopic facial rejuvenation procedures. So if you would outline for our audience a little bit about what the simplest things that you can do when you're just kind of sticking your foot in the water and you're interested in maybe tightening your skin a little bit or doing something that doesn't have a lot of downtime.
So certainly, I mean, I think that for most patients, surgery scares them, right? I mean, for a lot of people, there is an innate sort of stigma associated with plastic surgery. Number one, that it may not be natural. Number two, that it hurts or it changes who they are. I mean, there's a lot of kind of stigma associated with plastic surgery. Certainly, I mean, both you and I know that the measure of success with plastic surgery is naturalness, right?
Absolutely.
And making sure that it's an enhancement of who they are and not really changing who they are. In terms of non-surgical, though, there is no question that everyone needs in the aesthetic world to start off with crawl and walking and not running. And when we say
that can
running,
be so scary to a patient when they walk into a surgeon's office even getting to the surgeon's office is hard because they're worried that it's going to result in a surgery.
Sure.
So absolutely.
Right, and especially when your name is wave plastic surgery.
Absolutely.
I mean, I think it does kind of to a lot of patients kind of like put a little barrier, because I'm going to a plastic surgeon's office, and sometimes that equates to drastic change. Sometimes it equates to somebody who, is looking for something, completely different than what they really
And
are.
that's something that a lot of people imagine happens in the later decades of their life.
Sure.
Which isn't necessarily the case now.
Absolutely. Listen, I mean, I think both you and I know that in terms of aesthetics, right, the reason why there is such a big demand for aesthetic procedures, both non-surgical and surgical, is we're obviously all living more productive life. We are living longer. When you're in your 50s, it's not like as if you're really thinking retirement. You still have a lot of ambitions and goals that you have set for yourself. A lot of people are having children, when they're in their 50s. So, 50s of now or 60s of now is certainly not how it used to be 20 years ago.
Absolutely.
And the demand for the aesthetics is really because the way that you feel in the inside is certainly different than the way you look.
So that's a little bit about the philosophy. Let's dig into a little bit more about some specific technologies. A lot of times when people come into the office, the first things that they encounter us for are for neuromodulators or fillers. Can you just describe a little bit about what we have here, Wayne?
Sure. I mean, we obviously have the full spectrum, right? I mean, so whether it's neuromodulators, whether it's fillers, whether it's energy-related devices, I mean, that's what we obviously have.
If you had to categorize the ways that we begin and then progress in facial rejuvenation, outline that for me, if you would.
So certainly in facial rejuvenation, you can kind of categorize the aesthetic procedures into two types. One is enhancement of appearance, right? I mean, wanting to look more beautiful or prettier. And the other categorization is anti-aging, right? Wanting to look younger. Certainly there's a blend between the two, okay? I mean, in our type of practice, we certainly have a lot of young people coming in, as well as people who are, considering some sort of anti-aging procedure.
So for those listening to us, I think it's important that we just kind of go away from some of the jargon that we use, because anti-aging is going to be things that are repositioning procedures, things like facelifts, versus a enhancement, which would be something like a rhinoplasty, changing your nose.
Sure.
So we'd separate those two things into number one, looking younger, number two, changing your appearance. What are just a couple of the other procedures besides the idea that you're going to change your appearance with a rhinoplasty? What are some of the other procedures that we would offer somebody?
Well, I mean, certainly, it's not just surgery that we're talking about, right? I mean, it's also non-surgical as well. These days, with the utilization of the neuromodulators and fillers, we can change both their appearance, and especially the balance and proportions of their face, as well as making them look.
I think you really touched on something important there that isn't commonly available at many other practices, is some of the things that we do with the neuromodulators to try to change the facial aesthetics and the facial proportions. Can you describe a little bit about some of the things that we offer?
Sure. I mean, I think the classic thought about the neuromodulators is it's for wrinkles.
Absolutely.
And classically where? I mean, it's along the crow's line, it's along the glabellar region, and it's along the forehead, where people commonly, as we get older, develop wrinkles of expression. Okay? And certainly, I mean, the neuromodulators are almost irreplaceable in terms of treating those wrinkles. But in addition to that, there has been a lot of advancement, certainly, in the other aspects of it, such as for a lot of people who think that their jaws are a little bit on the square side, a little bit on the wide side, we can inject neuromodulators to the muscles of what we call the masseter muscle to decrease the bulkiness there, and thereby changing the shape of the lower part of the face from more wide square jaw to a more narrow and more slender type of a jawline.
Which I think brings up the idea that we're using something that was introduced initially in plastic surgery for an anti-aging problem, wrinkles, and then using it for an enhancement procedure.
Absolutely.
So specifically then, besides neuromodulators, what are some of the other things that you can do to change the angularity of somebody's face?
Certainly, I mean, I think we use the fillers very often now to perform what we call non-surgical rhinoplasties, non-surgical chin enhancement. I mean, those are central structural elements of the face that a lot of people want enhancement. And with the fillers now, we can smooth out the contour of the nose. We can also enhance the angularity and the definition of the chin as well.
So what's the downtime for any of these things? Is it, since you're doing something that's not usual, that other people commonly don't do in other plastic surgery practices, is it more invasive? Does it have more downtime? Is there something extra that besides the experience of practitioners?
Right. I mean, the fantastic thing about these neuromodulators and fillers are it's not surgical. There is really no downtime associated with it. You may get a little bit of swelling, but with the way that we actually do fillers now, where we use what we call cannulas, front tip cannulas instead of needles, certainly there's less pain, there's less trauma to the area, so there's less risk for bruising as well as swelling.
And we've got multiple practitioners here at WAVE at the 5 offices that we have currently open that are all adept at all these things, correct?
Yes, absolutely. And you know what's really good about having the size of the practice that we have is that we have different specialists from different facets of experience that brings together the different types of ideas. And what we like to do is we like to forge a common best practice type of management.
Going across all the different levels of practitioners.
Absolutely.
And I think that's really important, that it's not just the doctors that are doing that and the surgeons. We've got mid-level providers that are doing a lot of that. And a lot of times they can be more easy to get an appointment with. They're available wider variety of times, as well as at other locations rather than the kind of the central heart of WAVE, which is here in Koreatown.
Right.
Talk a little bit about the next step after doing fillers and Botox for facial enhancement.
So for facial enhancement as well as anti-aging, the way to think about all type of options is, again, there is completely non-surgical, which means there is no invasiveness, through the skin, versus surgical, which means obviously anesthesia and cutting and certainly downtime. In terms of non-surgical, again, this is where technology comes into play. There are a variety of non-surgical type of devices that is really beneficial for a variety of things. And what are the variety of things that a lot of people are concerned about? Number one, it's the natural aging process, which is a combination of sagginess of the face along with hollowness of the face. The other aspect to this is discoloration. Some people have pigment issues. Some people have acne issues. And so these are the kind of procedures that we can sort of tailor to what that individual really has, and prioritize what's important, what's not important, and treat them accordingly.
So once again, now you've kind of hit on the 4 major things that contribute to aging, which are going to be sun exposure and muscle action, loss of volume in the face, and then gravity. And as we've discussed with some of the other surgeons here, we have many different techniques to address those different things. Mm-hmm. And that's mostly in terms of anti-aging. When you start to talk about technologies in anti-aging, the attention's of course going to turn to surgery at some point. because it's one of the strongest ways we have of combating gravity and repositioning the structures of the face back to where they came from.
Sure.
So talk a little bit about your expertise and the expertise here at Wave in the cutting edge technologies that exist today.
So in terms of surgical options for rejuvenation, which means surgical options for lifting, there are a variety. From more minimally invasive to a more aggressive but more complete result type of procedures. There's no way of getting around it. I think for most patients in their lifetime, at some point, they're gonna need face.
And I agree with you entirely. And one of the most important things is that when people come into the office, we spend at least some time with almost every patient explaining to them that a small procedure is not going to have a major result. It's just not probable, possible even. So when you think about that, we've got a spectrum of things that we can offer. And if you just kind of outline a little bit, and you don't have to go into the specific names, but you could just say, you know, from simplest to more complex, what are some of the procedures that we offer anti-aging wise for repositioning the structures of the face?
And for anti-aging, I mean, the first thing, the first line of treatment, certainly besides the fillers and the neuromodulators, are skin tightening type of devices that's out there. And so we certainly have a variety of skin tightening devices, from all therapy to Scarlett to a Fractora. I mean, there's a variety of different type of machines that's suitable for different type of people.
And so it's important that if an individual is interested in this kind of thing, that they come in and get a complimentary consultation with initially our consultants and then with the surgeons that are also going to see them.
Yeah, I mean, certainly, I mean, customization is the most important because everybody has different, not just their condition itself, but they have different types of thoughts about how much of a change that they're truly looking for.
And one of the things in my experience I notice is that some people, they'll come in and they'll be very fixated on a particular procedure, and they'll be like, I just want to get my lower eyes done. I hate this. And then when you look at them, you realize that just fixing their lower eyes is going to result in a somewhat inharmonious look to them.
Mm-hmm.
And at least I find that once they start looking at themselves, you can kind of add the idea that, maybe you might want to consider your upper eyes, because I think that has a more important component to your facial aging. How do you specifically deal with those patients? What's your sense? Some people, some surgeons tend to put everything together and say, I'm going to decide what you want. And other people, as you've alluded to with yourself, you listen to the patient and customize it. How do you do that? Is it just only with an in-person consultation? What if somebody's not here in the Los Angeles area?
Oh, I mean, certainly, we do a lot of video conferencing consultations. But in terms of how to address, different patients, listen, I think our job is pretty simple, and that is, we are code specialists, right, in the aesthetic field. When a patient comes in and is asking for a certain type of procedure, certainly, it's our duty, number one, to be able to address all of the questions and the risks and benefits of that type of procedure. But beyond that, of course, I think that a consultation is incomplete without discussing what you actually see. And that's openness and honesty, and quite frankly, the rapport that you build with the patient.
I was going to use the same word.
Absolutely essential.
When you get to meet a patient, and I know from my own experience with you, you're a quieter guy and I'm a louder guy, until I see you do one of the video consultations. And really, that's one of the things that I notice, is that that's when you really come alive. Design of operations, at least I notice that. It seems like something that you're very passionate about. Describe what goes through your mind when you initially see a patient.
The first thing and the most important thing is first listening to what the patient has to say first. Mm-hmm. Really kind of understanding what type of patient this is. How much does this patient really understand about what they are interested in? There are some people who, as you said, are very specific about what they want. And these days, patients are, on the most part, very informed. They have done their research. Listen, I mean, when you're actually gonna come in and you're speaking with a plastic surgeon, it's not something that they are doing it in a way. I mean, they really thought about it twice, maybe even longer, and it's a true investment in their part, both in terms of their time, as well as that sort of that anxiety that kind of builds up.
And one of the things that I like to remind people, both the patients that we see and the people that we work with, is our job is to remove the obstructions. People come in, and obviously this is concerning to them. It takes a lot to jump that hurdle to actually show up to a plastic surgeon's office after you've looked at yourself in the mirror enough and finally gotten to the point of where, wait a minute, I'm concerned enough that I need to go to change something. Whether it's because you want to enhance something or because of aging.
Right.
And I think that's one of the big things is our job is to remove obstructions.
And act as a guide.
Absolutely.
I mean, you can't conform patients to the way that you think.
Absolutely.
Right? Because honestly, the patients know themselves the best.
And so meaning that you've got to specifically address the things that bother them the most. There's an interesting idea about symptom amplification and the idea that people, when they're evaluating themselves, even though somebody else may be looking at their face, they're like, oh, that doesn't really bother me that much about you.
Mm-hmm.
But to that patient, how do they regard it?
Sure, absolutely.
They see it as a much bigger thing. And it's like, maybe it's a small mole, maybe it's that their ears stick out a little bit, maybe it's that they have jowling. But patients come in and talk to us.
And it is utmost importance to really understand what the patient really is looking for and the basis for the improvement that they're looking for.
So I think one of the important things is that even though you and I are pretty senior surgeons, as much as we don't like to admit it sometimes, and we've got a lot of experience, we try to learn all the time. I think it's worth touching on a little bit of your international experience.
I mean, certainly, I think that although the US is both the capital of aesthetic procedures, now the world is small. And certainly, there in different parts of the world now, there is more advancement in certain types of procedures. And certainly, I travel internationally to not just learn, but also to share. So it's kind of a give and take, certainly. There are certain things that I believe that I have expertise on that I can share with international surgeons. And at the same time, there are certain other type of procedures and knowledge that they can pass on to me.
And I think that's true of anybody who enjoys doing surgery, is that they like to see how other people do things because maybe there's something to learn. It's 2019. You recently came back from an international trip, and what would you say is one of the things that you're most excited about for the future of plastic surgery? Technology-wise, here at Wave, any of the above, or both?
Certainly, I think one of the things that I've noticed over specifically in Asia, that's where I just came from, is the importance of anti-aging. In Asia, classically, there has been a lot of focus on plastic surgery being more for younger people, right? Because there's a lot of eyes and nose that's being done in Asia, which is kind of different from what we experience here in the U.S. But the importance of youth, right, and looking younger than what you really are. Because you have to match with how you feel versus how you really look. That is certainly gaining a huge amount of momentum.
One of the things that I tend to tell patients is that I'm not an artist. Sure, there's artistic parts of what I do, but what I really am is an editor. People bring me the book or the movie that they've written over the course of their lives. And usually there's some loss of matching between their internal feelings and their external way that they look. And my job is to help edit that to where the book is ready for publication, so to speak. It reads appropriately, the sentence structure is nice, the cover is inviting. It's not a boring reference book, but it's actually an entertaining novel. And I find philosophically that's really important.